Cat Feeney on ABC Radio Brisbane and Queensland.
Do you have flashes of light in your peripheral vision? Well, if you do, don't panic, remain sang-froid and listen closely. Because it's time for your top tip for feeling a little bit better today, and the focus this afternoon is on your eyes. What if your eyes are itchy or red, or your eyelids are feeling a little tender, maybe swollen? Are you blinking more than you usually do? Are these issues that you're confident could be cured with a quick visit to the pharmacist, or should you make a call to the optometrist? When it comes to eye problems, what should you look out for? Who should you see? Julie Newport is an optometrist at ICU Optometry, and she's here today with your 5-minute top tip for health and well-being. Julie, great to have you on the program. Thank you. I guess I want to begin with some of the most common issues that people have with their eyes that might be easily solved with, say, eye drops.
Well, the most common issue is dry eyes, and that is sometimes as simple to fix as using a simple lubricating drop when they feel a little bit dry. The problem is that a lot of people will say, oh, I've got such and such a problem with my eye, I'll just use an eye drop and it'll be fine, not realising that, now there are some circumstances where you want that checked out properly.
Okay, so the key is trying to distinguish, and just a reminder, obviously, that today's chat is general in nature, and if you are having a problem with your eyes, then you're advised to see the appropriate medical professional in person. This might help you with that decision-making process, though, Julie. So let's look at some of the other eye problems that we face. What else do we need to think about?
Well, in Queensland, it's not such a bad idea that you might want to keep your drops in the fridge if you possibly can, because it can get very, very warm after around about now. I think we're up around 30 degrees today, and you'll notice that some of the drops will have temperature recommendations on them to keep the drops stable. But if you're in your air-conditioned office for most of the time, then you can probably keep them in the drawer and they'll stay mostly pretty cool there too.
Mm-hmm. What else do we need to know?
Well, there is one particular occasion where when people find themselves with a particular condition, that they should just go straight to the pharmacy and organise some over-the-counter antibiotic drops there. The problem with that is that too many people say, oh, gee, my eye's a bit red, I don't know what to do, so I'll get an antibiotic just in case. And a lot of the time that's completely inappropriate. When might it be inappropriate, Julie Newport? It's very inappropriate if you've got one red eye, or if your eye is light sensitive. So if you open it in a light room, a brightly lit room, and it actually hurts to have your eye open, then that is not the time to go to the pharmacy and grab some over-the-counter antibiotics. That's the time to see somebody who knows what they're doing with eyes, and that's your optometrist or your ophthalmologist. What are some other symptoms of a problem with your eye that would suggest a pharmacist isn't necessarily the best course of action? Well, there's one that I wanted people to know. It's actually not the best to see the optometrist for this one either. There's what's called a TIA, which is a transient ischemic attack. And that's as simple as you're just sitting there minding your own business and all of a sudden your vision just goes in one eye, and it just goes for a few seconds, but then it's right back again. It's fine. And so most people would go, oh, wonder what that was, and not worry about it so much. But in the worst case scenario, that can actually be a transient ischemic attack, and that can be prodromal to having a stroke coming your way. That's when you should see the GP and say, look, I had this happen, and then they'll put you through the appropriate workups to make sure that you are healthy and not actually heading for a stroke. Goodness. Okay, so we're looking at GPs, we're thinking about optometrists, ophthalmologists, a pharmacist. I mean, there's really a lot to consider here. What might be your key message, Julie Newport? The key message is that if you're not sure, see your optometrist. If you've got something like a red sore eye, ring the optometrist and say, can I get in to be seen today? And if you say the magic words to the people at the desk, such as, I've got flashing lights in my periphery, or I've got a red sore eye which is light sensitive, then these are usually the magic words that will get you seen that day, even if you have to be squeezed in between other people. And why is that? Oh, because some of those problems are immediate. They need immediate diagnosis and immediate attention. So, for example, if you had flashing lights in your peripheral vision, then a lot of the time that is something that's completely innocuous and it's not going to be a problem at all. And that's why people shouldn't panic. But sometimes that is a retinal tear or a retinal detachment, and they really need to be diagnosed and treated immediately.
Julie Newport, thank you so much.
Thank you.
On ABC Radio Brisbane and Queensland, Julie Newport, optometrist with ICU Optometry. We'll be back with another top tip for feeling a little bit better today, tomorrow.
On your radio and online.
At home or on the road.
This is ABC Radio.